Kay Jewelers' early Black Friday sale is happening now. Get up to 50% off Black Friday deals and up to 40% off everything else. Don't miss this sale. Start your season with savings, only at Kay. Exclusions apply. See kay.com/exclusions for details.
The show that makes you laugh, think, and occasionally uncomfortable. The Last Show with David Cooper.
The pet stories of the week we will discuss here with Dr. Cliff Redford on Vet Talk or Pet Talk. His podcast, Vet Life, can be found wherever you download podcasts. We're going to talk about cats and memory loss and dementia because cats can get it too. Cliff, welcome.
Thank you. It's kind of nice to talk about cats. We seem to mostly be talking about dogs.
Boring. I'm a cat guy.
I know. Tomato's been sending me messages saying I feel left out.
He has a horrible sore on his body that he won't stop licking, and so we've put a little bib on him, and he looks so stupid, and he doesn't know how to walk with it. It's like there's fabric up against his legs, and he's he's just dragging his butt around the whole apartment because he's forgotten how to be a cat.
The thing is, you're literally just putting a Band-Aid on it. Have you figured out what the problem is?
No, but we've taken him to the vet, and they're sometimes he gets little sores, and then he licks them too much, and they get infected. I think he might have cut himself or something like that.
Where are these? Where's this lesion?
Usually on his chest area. Oh boy.
Sounds like miliary dermatitis.
Oh no.
That's a fancy term for cat eczema.
Oh no, he's got kitty eczema?
Is it eczema or eczema? Eczema.
I don't know. You're the doctor.
That's why I call it miliary dermatitis. I can bill $300 more if I call it miliary dermatitis.
I feel like the human equivalent. You go to your doctor and you show them something awful, and then they pronounce it wrong, and then you say the right way, and they're like, "Oh, is it pronounced that way? By the way, we're going to do surgery on it." I'm like, "What?"
And I'm going to prescribe some penicillin.
Penicillin, yeah, the it's the uncle biotic that you have to worry about. Okay, humans can get classic dementia. That is where are we? Who are we?
Cats and dementia, cognitive dysfunction syndrome, as we call it, but basically, kitty cat dementia. Cats get it too. More than 50% of cats that are 15 years or older show multiple of these 8 signs. And look, people get cognitive dysfunction. And dogs, we definitely know dogs get it. There's been a lot of studies. There are drugs. I love this article.
Drugs.
There are drugs.
Are the drugs related to the dementia, or are you just announcing that there are drugs?
There are drugs. David, sometimes I forget why we're
come here.
I wish I had David dementia. I wish. Okay.
Yes.
There are 8 symptoms. I'm gonna see if you can figure them out.
Well, considering I have the article up in front of me that we're going off of here from a reputable scientific publication.
Sidepost.
Yeah.
Okay, well, we're just going to go through then at 1 to 8. Unusual vocalization. So
that's what that says. What if my cat's already an idiot and vocalizes a lot? He's good, right?
It's got to be a change.
Okay.
Yeah, it's a change.
Got
it. Crying excessively, crying in new situations. Now, look, a lot of these things can be other conditions, right? Arthritis, renal disease, hormonal changes, even hearing loss. If your cat's hearing is starting to go, they're going to start meowing a lot more because they can't hear their own voice. But unusual vocalization, altered interactions, meaning they're extra clingy or they're extra aloof. They're ignoring you more. They're sort of not recognizing you or not recognizing people in the family, not jumping up on the couch and cuddling with you, and they normally do when you're watching, Monday Night Hockey. Night in Canada.
So if Tomato stops yelling at me at 11 for his little kibble snack that we give him, then I'll know. Like
Yeah.
big behavioral. They have got habits, your pets, and if those habits start changing dramatically,
then you got an issue. And this is a good point. Like I imagine it's annoying to you at 11 p.m. when Tomato howls at you, and bugs you for a snack. So if he stops doing that, that's not good. You may appreciate that, but any sort of change is a change that needs to be considered. Sleep changes, so they're not sleeping at night, they're sleeping more than usual. A big one, house soiling. So they're peeing or pooping out of the litter box. Now, look, this can be a urinary tract infection. It can be interstitial cystitis, inflammation of the bladder wall. It can be arthritis, just cats with arthritis. They have trouble getting up into the box, or they have trouble pushing when they got to go poop. So they avoid it, and then all of a sudden it's coming and they can't run up the stairs to the
like
box.
A wrecking ball.
A wrecking hairball, that's right. Disorientation, so confusion, wandering, staring blankly at the walls. That's a big one. My dog had that. Is he would stare at the corner of the wall and eventually start barking at it. And near the end of his dementia, he would lick the wall. So that was a very unusual behavior. Changes in activity levels. Obviously, they're going to play less as they get older due to all kinds of different factors. But a big one is if a cat stops grooming themselves, or they're not grooming themselves as much.
Interesting.
That's a big issue. Appearing anxious, hiding. And then the last one is unable to do previously learned tasks. So if you've taught your cat how to wash the dishes and they're not washing the dishes anymore, maybe you don't just have to punish them. Maybe this is a medical issue. You need to cut them some slack. So
if Tomato was able to run the soundboard for this radio show and then all of a sudden he couldn't, that would be a big sign.
Can he not?
No, he
Okay.
can barely. He's not. He's not a smart cat. He's a great cat, but he's not a smart cat.
Are there bad students or just bad teachers? Are there dumb cats or just bad pet owners?
Why can't there be both?
That's true. That's true. What are we talking about?
is
Anyway,
a great
so
question.
look, you got to avoid this. There's very little treatment. That's the problem. There is for dogs. There isn't for cats yet. But these sorts of studies are going to help push the pharmaceutical world. Improve their overall health when they're younger to avoid it. Improve their overall health, especially proper body weight is such a big deal for overall health and for brain function.
And how do you do that? Just make sure they're eating right and healthy and all that?
Yeah, don't feed them too much, get them lots of exercise, specifically with cognitive dysfunction or dementia. Constantly have IQ stimulating games and puzzles and the little feeder puzzles for cats, and recognize they're supposed to be outside. Don't let your cat outside. But originally they were meant to be outside hunting and chasing animals and trying to use their brain to survive. And now we've got them stuck in a condo or in a small house. So you need to give them that sort of brain activity, not just physical activity. And then lastly, a diet that's high in omega fatty acids, high in antioxidants can help, all these things. But at any time, if you're concerned about changes in your kitty cat's behavior or physical state, talk to your veterinarian, because it may not be, in this case, it may not be dementia. It might be something else. There might be some painful arthritis. There might be even a dental problem that's affecting it gives them a migraine. We can't concentrate when when we have a migraine. So talk to your veterinarian, please give us the business. We're here to help you take care of their pets.
Cliff Redford is here. Is it a good idea to declaw your cats? The short answer, no. The long answer, coming up.
The same answer, no.
Oh, okay. That's it. Thanks for being here. That's the whole show. Cliff is a veterinarian. It is Vet Talk or Pet Talk, and find out Cliff's podcast. Find out Cliff's podcast. English. The
That's
podcast
all right,
is
man. We
good.
got the face for radio and the vocabulary skills for the same, I guess. I don't know.
In the brain for one. The show's called Vet Life. Check it out wherever podcasts are downloaded. Okay, declawing your cat. Good idea. I thought it was banned. I used to live in California, and I thought it was banned there.
No, I mean there are certain cities that have banned it. But there's only 7, including California now, there's only 7 states that have banned it.
Any provinces?
So you're spoiling the ending here.
Oh, okay.
Every single province has banned declawing in cats in Canada, except for Ontario.
Oh, boo.
Like, what the heck?
Wow. Well done.
I had to think there for a second. Like, okay, let's talk about this. So, Governor Gavin Newsom signed Bill 867 October 9th, 2025, banning declawing or tendinectomy, which is where you cut the tendons so cats cannot exteriorize, basically make their claws come out. They're one of the few animals where their claws can retract and like when they walk, their claws are inside, and then they flex their fingers and the claws come out. So there's this very barbaric, even worse than declawing, I think, tendinectomy. Basically, the only time you're allowed to declaw is obviously the veterinarian has to decide, and there has to be a medical reason. There is an autoimmune condition in cats and dogs and probably other animals where they become allergic to the nail beds, and it's an incredibly painful, debilitating condition, and the only solution is removing those claws. It's like amputating a gangrene finger, you know?
Yeah, and there's cases where claws become so infected and gangrenous that they need to go, but these are like fraction of a case, yeah.
And basically in California, if veterinarians continue to declaw without meeting those sort of requirements, they face a fine and even license suspension. And eventually, if they continue to do it, obviously they wouldn't, but if they continued to do it, they could lose their license permanently. The issue is, like, I think everyone kind of understands now that we are removing the third knuckle and then beyond, and then sort of the tip of the finger. And it is as close to, if you think about us removing the third phalanx, the third little knuckle on our own hands. It comes with a slew of surgical complications, pain, infection. If you don't do it properly, the nail can partially regrow under the skin. But long term, because look, I used to declaw cats. I did it until, even though it's still legal in Ontario, I stopped in 2002. So 4 years after I graduated. I was just like, this is dumb.
It was just done 20, 30 years ago, which is so wild to me.
Yeah, it was. I had a cat that was declawed. My cat Rye, she was I guess rescue. I adopted her from the local pound when I was in high school. And when she got spayed, we also declawed her. That was what everyone did. But we didn't know, like, we were ignorant. We're still ignorant, but about other things. We didn't realize that first of all, it hurts. It's all these problems, et cetera, at the time, but it increases significantly behavioral disorders in the future, aggression, urine marking, and it's basically because it completely screws up their cortisol and adrenaline levels. It also increases significantly pelvic and hind leg arthritis.
I believe it.
There you go. And most people go, you're smart. Most people go, what? How is that possible? And you say, well, look, it changes the way they walk. So they did this force plate analysis at the University of Guelph, my old alma mater, where the cats, when they were declawed, like a year after when they were all healed up, et cetera, they would walk on these force plates, and they were showing a significant change in the amount of weight they're putting on their back feet, which totally makes sense. And if you put more, you kind of change that pelvic tilt, you think that the cat's walking on all four, it increases the risk significantly of hip and pelvic arthritis. So there's no reason to do it. And it's frustrating that Ontario still allows it. It's frustrating that the Canadian Vet Medical Association does not agree with the American Vet Medical Association's wanting to ban. So AVMA, American Vet Medical Association, wants to ban all across the United States. They want to make it federal that it is banned. And the CVMA says, well, no, we don't want to remove this possibly functional surgery, this technique or this method, or I don't know. I think their arguments BS. They don't want to remove the veterinarian's option. Well, we still have the option if there's a medical reason. That's not the issue. The issue is it's just willy-nilly. When I stopped doing it, and I said 2002, that was a mistake. It was 2004. 2002 was my last declaw, but I didn't ban it at my hospitals. I owned 3 hospitals at the time until 2004. And the difference is I was educating owners. I'd say, look, when they came in with a kitten, I'd say, okay, you're going to get them spayed, you're going to get them neutered. Have you thought about declawing? And if they're like, yeah, we're thinking about, what do you think? And then I would explain the process and say, look, just follow these steps of training your cat not to be destructive now when they're a kitten, and you're not going to need to declaw them. And so I went 2 years without having to declaw cats. And then there was a situation where a person was like kind of forcing me or trying to force me with this adult cat, and they were going to get rid of the cat, and et cetera, et cetera. I still refused. They went and got it done elsewhere. 6 months later, they got rid of the cat regardless.
Awful.
And that pissed me off so much that I said, you know what, I'm done.
Jerks.
I'm just going to say it's banned. So bravo, Gavin Newsom. Bravo for the Newsom.
Yeah. Newsom.
Bravo, Governor Gavin.
GovGav.
The GovGav. And anyone who bans this, and for the veterinarians who are still doing this, shame on you.
We got about a minute left. Let's talk about the study that looks at human-grade food on dogs' health. It seems like it would be healthy. Why not?
Yeah, and, we've talked a lot about raw food and the dangers of raw food. And just for those people that sort of yelled at me on social media that I'm a shill for the food companies, look, this is a study. This is just cooked homemade food, essentially. It was done at Cornell University, one of the top veterinary schools in the world, usually top 5. And they did it with The Farmer's Dog, which is a company that makes human-grade, organic, fresh food. They used 22 senior Alaskan sled dogs. They fed them. Half of them got commercial dog food. Half of them got this farmer's dog food. They showed the dogs that were getting the fresh food, increased antioxidants in their bloodstream, better branched-chain amino acid metabolism, better fat utilization, reduced glycemic control or improved glycemic control, so reduced risk of diabetes. Everything that we can test for as far as nutritional effect showed improvements in like muscle and neuro health. We can extrapolate from that these animals are healthier, but we haven't done the long studies, but it's a good study.
Dr. Cliff Redford. If your pet is sick, take it to him if you have the money. Cliff, thank you for joining me. I appreciate you being on the show.
Thank you, David.